Good morning, good afternoon, good evening, depending where you're based, and welcome to the third edition of the Global Public Health Week, an initiative of the World Federation of Public Health Association. My name is Marta Lomazzi, and I am the Executive Manager of the World Federation of Public Health Association. Today, we have the great pleasure to discuss with Professor Fidelia Cascini, who is Professor of Public Health at the Catholic University in Rome, Italy, as well as expert in digital health and advisor to the Minister of Health in Italy. She is also part of our Public Health Leadership Coalition, where she has led a project on infodemic, together with experts of our coalition from all over the world. Welcome, Professor Cascini.
Thank you very much, Dr. Lomazzi, for the invitation. It's a pleasure to be here.
Thank you very much. So let's start to get a better understanding of what is infodemic, because we have heard so many things about infodemic during the pandemic, but not everyone within or outside the public health sphere knows exactly what it is, except, of course, for the expert like you. So could you please tell us what is infodemic in public health, and why we can consider infodemic a major health threat?
Yes, the most appropriate definition of infodemic is that of WHO, which defines infodemic as the phenomenon of an uncontrolled spread information in both digital and physical environment during a disease outbreak, as we experienced during the COVID-19 pandemic. But the main issue is that infodemic is causing confusion and risk-taking behaviors that can harm health of people. So we all know that health-related communication is related to the increasingly use of the internet and social media, so that people are allow the access to a massive quantity of information on various health topics. And in using these technological tools, people and actors who managing these tools are not always acting in good faith, but and following scientific methods. But sometimes, and maybe during public health emergency and crisis, this phenomenon is more evident. These people who are acting not in good faith are producing information which are not scientific based, which are not based on the evidence produced by scientists and by medical science. So the risk is the dissemination, the consequence is the dissemination of these a lot of fake news, and people are not able often to distinguish what is fake news and what is a good news related to their health. So people behavior can be affected from this phenomenon, and the consequences in the public health areas is mainly related to behaviors which are not in line with public health recommendations from institutions, from competent authorities, from public health experts. So one of the main challenges that health professionals, especially those working in a public health environment, is related to the estimation of tools to fight and contrast this phenomenon, and to control misleading health information.
Thank you very much. So a big threat to health, if not managed properly, and you have started describing a bit the impact on infodemic during the COVID-19 pandemic. Can you please elaborate a bit more? Do you think that infodemic impacted the implementation of preventive measures as well as the uptake of the vaccination? And if so, how much was the impact of this infodemic on how population reacted towards what was proposed by the government and health authorities?
Yes, historically, infodemic has been reported for vaccinations and healthcare emergencies because these are the situations during which is easier to distribute and disseminate also fake news. And especially during this time, there are obvious adverse effects on people's health when there is misleading information available on the internet and on the social media channels. Recently, we experimented this situation, and this situation was intensified during the COVID-19 pandemic, especially related to vaccination campaigns. And the main actors of this phenomenon were the no-vax people, discouraging the general population and towards the vaccination, and increasing fear in accepting preventive measures to control the dissemination of the virus. So it is very important that during the emergency, the public health emergencies, public health institutions and public health professionals are prepared to face this collateral phenomenon, which can have a great impact on the public health measures to promote public health solutions in the interest of health, of people's health.
Thank you very much. So you have afterwards led a great activity with our Public Health Leadership Coalition to develop a tool to manage infodemic, to make a good use of communication when is more needed. Can you please describe this work and also which are the outcome of the project?
Yes, sure. We started for the project within the WFPHA Public Health Association and with the Leadership Coalition, with the support of the Leadership Coalition, with the literature review, to identify available approaches, tools, policies, recommendations, all the available instruments to contrast the infodemic phenomenon from a public health perspective, and also with the goal to recognize the main existing gaps and bottlenecks in this area. After completing this systematic review, we went ahead with the idea of creating a standardized toolkit based on a multidisciplinary approach to provide a solution for public health professionals specifically to detect fake news on the internet and on the social media tools. Right now, we are developing this toolkit also with the support of artificial intelligence algorithms under a specific project which was funded by the Ministry of Education in Italy, and addressing the aspects of pre-banking and debunking, which are strictly related to the dissemination and the increasing of infodemic.
Thank you very much. Within this toolkit that you prepared together with the Public Health Leadership Coalition based on the review that you performed, you could identify 5 key strategies to counteract the infodemic phenomenon. Can you please dig a bit more in these 5 strategies and share with us few tips on how we can all apply those strategies in the different contexts in the different countries of the world?
Sure. We identified these main strategies as common to practice, for a good practice, for a best practice to manage the infodemic phenomenon in the public health area. And we selected in particular the cooperation with authorities and institutions because it's a relevant, a synergetic approach, giving support to public health authorities to identify the fake news which are of interest for public health sector, and also to promote legislation and policy interventions which can support the public health professionals and experts in doing this action. And this is the first one, cooperation with authorities and institutions. The second one is the literacy and the people education, because it is essential that people understand and are aware of what is infodemic, what are the consequences of infodemic in the public health sector. So the actions related to these strategies are, for instance, the creation of competent task force able to collect evidence from one side and to transfer this evidence and these competencies to the general population to identify the fake news in the public health areas. And the general population, but more specifically, the healthcare professionals, because they are the main actors in this context. The third element is related to the dissemination and the creation of contact points. Contact points with the cooperation also of the institutions, but not necessarily, because the contact points that for healthcare workers and for people that are, for instance, distributing this fake news, even without an awareness of what they are distributing. Let's think, for instance, to the social media platforms. The managers of social media platforms don't know exactly what are the contents of this information, but a cooperation with these companies can support the actions of contrasting this kind of phenomenon. So dissemination and communications with companies which are the managers of the channels to communicate. The fourth element is related to surveillance. Surveillance because we should have a clear idea of where these information are placed and where these wrong information, fake news, are placed, and is essential to detect the websites or the main actors of producing this false information. And related to this, which is the fourth, the surveillance, the fifth strategy, which is related to pre-banking and the debunking, because it's relevant to create a network to share surveillance actions and results of these surveillance actions, exactly to create to strengthen the actions to face this phenomenon.
Thank you very much for this very broad overview. there is really a lot of area where different organizations can and should cooperate to make sure that we prevent the spread of fake news, and that we use, on the other hand, good communication to support scientific evidence-based measure to protect the health of our communities everywhere in the world. And very interesting for me was really the cooperation word that you repeated under several of these main pillars. That is not only cooperation with authorities, health authorities, but also with leaders at different level, and with corporates that are in charge of disseminating of the channels, so where we can have good or bad news. So this kind of very broad approach is very much needed nowadays to make sure the information is spread in the best way. And if you allow me for one more last question, you developed together with the Public Health Leadership Coalition a kind of standardized and international toolkit to address infodemic. So what are the benefits of using globally a standardized tool, and how you plan to adapt it to the different regions, even better to the different countries in the world, where the approach to news can be different, or where the channels to share the news can be very different?
Yes, sure. As you told before, one of the most important aspects is the coordination. And the most valuable is of these aspects related to the coordination is exactly to reach a coordinated action among all the association to promoting public health all over the world to maximize the effort, especially if we look at this kind of phenomenon, which is the infodemic and which is related to the communicating channels, channels for communications, which are widespread and are so quick in distributing information all over the world. And especially in the field of public health, the challenges are common and widespread, and the professionals and institutions' reactions to be effective should be harmonized. We learned this during the COVID-19 pandemic, because when we acted using an harmonized and a coordinated approach, the effects were most valuable, more effective, and the conclusions and the results were really satisfying for public health professionals and public health leaders and institutions. So, in the environment supported by the World Federation of Public Health Association, one of the main goals could be to manage together the approach towards the infodemic phenomenon and to create an harmonization in realize initiatives that can be really valuable just if they are well coordinated in identifying where and when to act with specific tools and toolkits as those that we are going to create under this project.
Thank you very much. And once again, I love to hear this word of coordination, harmonization, and really working together to make sure we protect our communities. So that's all for today. Thanks again, Professor Cascini, for sharing your knowledge and for leading these very important projects. And I thank you all the people, public health professionals, citizens, journalists, policymakers that are listening to this interview. And I invite them to contact us if they want to know more about the infodemic tool that has been developed with the Public Health Leadership Coalition. Thank you very much.
Thank you, Dr. Lomazzi, and thank you, the audience. It has been a pleasure.